in our health district's region. And today we're here to announce the second case that is in a Madison County male who is a BYU Idaho student in his 20s. The number of COVID-19 cases across the state have increased since the first one was announced last Friday. We expect, and we know, and we did expect that these cases are going to continue to increase in our state. And we've been preparing since January in our state. And you can see here we have lots of local partners that have been working tirelessly to be prepared for this specific event. We've been working closely with healthcare providers, hospitals, schools, county emergency managers, local and state government officials, and others. This first case in Madison County is related to travel outside of Idaho. The patient became symptomatic on Sunday, March 8th, while he was still out of our state. He returned to Rexburg on Wednesday, March 11th, and he remained at home until seeking medical care on March 12th. At that time, he was tested for COVID-19, and after the test, he was asked to stay at home until the test results were available. He will continue to be in isolation and monitored by Eastern Idaho Public Health. Eastern Idaho Public Health's epidemiology staff have already begun the investigation of this case, and they are quickly working to identify anyone that would have had close contact with this individual. It's important to know that health department officials will provide any individuals with close contact with guidance. They'll monitor them closely for symptoms and facilitate COVID-19 testing if they deem it's appropriate. Please understand that it is our duty to protect the confidentiality of this individual, and we are asking for your understanding in that. What is important to understand is that unless you're contacted by Eastern Idaho Public Health, you are not at increased risk for exposure to this individual and do not need to seek testing. I would like to introduce Dr. Clay Prince, Brett Sampson from BYU Idaho, Mayor Jerry Merrill from the City of Rexburg, and Commissioner John Weber from Madison County. These gentlemen will have statements, and then we will have closing comments and have time for questions.
Hello everyone, thanks for coming. I've just been asked to spend a minute and reiterate the guidelines for when to seek testing and what the symptoms of novel coronavirus are. First of all, novel coronavirus tends to cause fever in most cases. If you don't have a fever, it's much less likely that you have coronavirus. Along with fever, it tends to cause a cough very early on in the course of the illness, as well as shortness of breath, or at least one or the other. If you don't have those symptoms, it's fairly unlikely that you have coronavirus. The criteria for testing are if you have those symptoms, then, and also if you have a confirmed, if you know that you have been exposed to someone who has a known confirmed positive test. So if you don't know of anybody that has a confirmed positive test and you've had those symptoms, you may seek to talk to your healthcare provider about your symptoms, but you may not be tested for coronavirus, and that's the appropriate thing to do. Also, prior to being tested for coronavirus, even if you have that history, other things may be tested for before the coronavirus test is ordered, and that's also the appropriate thing to do. We also want to make sure and let everybody know that we've been expecting in Madison County that we would have positive tests to coronavirus. We knew that this would happen eventually, either now or later. There will likely be more positive tests as this epidemic unfolds. We want to reassure everyone that we're prepared for this, both as a hospital and as a healthcare community. I'm very proud of the way that our healthcare providers, both physicians and nurses and support staff and therapists, have prepared, and the way they've responded and the way everyone is ready. We want to reassure everyone that as a healthcare community, we're prepared to take care of this. We want to emphasize that it's not appropriate for everyone to run into the hospital and ask for testing. The most appropriate thing to do if you have questions is call your healthcare provider. If you don't have a healthcare provider, right now would be a good time to get one. And so look around, make some calls, find a person that you would like to establish care with, and get a primary care provider. And they can help guide you as to what testing, if any, would be appropriate, and they can help reassure you as to whether your symptoms warrant that. or not. And with that, I'll finish for now.
First of all, I just want to say that we at BYU Idaho are grateful and honored to be part of this professional team. Along with them, we care about our students, our employees, and all the citizens of our community. We have been taking all the recommended measures that our church educational system, leaders, government, and health professionals have been providing us. That includes, as was mentioned earlier, long before this outbreak or these most recent cases, we have been increasing the exposure of our Fight the Flu campaign, which is something we do every cold and flu season, telling everybody to do exactly what everybody now knows should be done and is hopefully practicing, and that's to wash your hands, to keep your distance, and all of those things. So we've increased that, as well as in the last couple of weeks, we have been sending out official notices via email to the students and employees, and all of that information is now housed on a dedicated webpage for information about COVID-19 and its issues at the university. We just last week suspended classes and gave students the opportunity to return to their homes. We are resuming tomorrow online only for the rest of the semester. And our Student Health Center will continue to follow protocol as we continue to work closely with the professionals you see here today. Thank you.
Well, folks, in all of these kind of situations, there's always some bad news, but some good news. You've already heard the bad news. The good news is we as community leaders have been preparing and working together on this issue since the first notifications of COVID-19. You can take confidence in knowing that we have planned for this day as well as the weeks to come. All essential county and city services remain functional, and we do not anticipate that changing. As government leaders do our part, we ask that you as community members please do your part in helping to minimize the impact on our community. Please shop responsibly, please care for the needs of your neighbors, and please follow the guidelines outlined on the Eastern Idaho Public Health website. As government leaders, it is our utmost concern that you and your families are safe and well cared for. As we work together with you, our community members, we are confident that the effects of the virus will be lessened on this great community. So for more information specific to Rexburg, please visit our rexburg.org website. If you have further questions beyond that, you may call our community helpline at 208-372-2129. And together with our county officials, our great medical team, and all of those who have been planning and working on this, we know that we can get through it together. Thank you.
So I just want to, again, mention that since there is no vaccine or specific treatment for COVID-19, it's really important for everyone to continue doing those things that we've been talking about, the everyday practices that can help protect you against all sorts of illnesses, just not COVID-19. We are in the middle of flu and cold season, and we are seeing lots of illness surrounding in our communities. Those measures that we should always be doing and doing more frequently are hand washing. Staying home when you're sick, that is one of the most important things that we can do to help prevent and slow the spread of this disease that we know is going to continue to be affecting our communities. Make sure you're covering your cough and your sneezes, whether it's with a tissue or with your sleeve, and then washing your hands again frequently. Try to avoid others that are sick and practice social distancing. And what that means is try to stay at least 6 feet away from others to give you that barrier from being infected with any germs that they might be spreading. I think when we continue to do these things, it's going to be very important, especially for those individuals that have underlying health conditions for which COVID-19 is much more severe. We need to reiterate that not everyone is going to be tested that wants to be tested, and we know that's a frustration for many people who feel that they have potentially been exposed. Another thing that I wanted to say is that there are, through the social media and online, there are so many rumors spreading that there's so many cases of coronavirus in our area. And I want to reassure you that any confirmed case of coronavirus or COVID-19 will be reported through Eastern Idaho Public Health. And the governor has established the coronavirus.idaho.gov website where those cases are being reported as well. And we have committed at Eastern Idaho Public Health that we will include case counts for each of the 8 counties that are within our health district region. Eastern Idaho Public Health has set up a coronavirus or a COVID-19 hotline. We've had that in place for nearly a month. We're getting lots of calls, and by far the most calls that we get is for those that want to get testing. And again, just to reiterate what Dr. Prince said, if you don't have symptoms, you won't be tested at all. If you have symptoms, but you don't have a history of being in close contact with a confirmed case, and that doesn't mean just someone that says they got tested for coronavirus and that's not a confirmed case. Close contact with a confirmed case or travel to an area where spread of COVID-19 is happening. The most important thing that you can do is to contact your healthcare provider. And again, if you have the travel history or contact with a positive case and you're having symptoms, it is so important for you to call ahead. Don't just show up at your healthcare provider's office and risk infecting other people. Please call ahead and get instruction from them. On Eastern Idaho Public Health's website, we are putting the most up-to-date information. In addition to all the CDC guidance, we are going to be putting their specific information related to our region, and we will be setting up tomorrow a system where people can submit questions that they have about coronavirus that we'll be committed to getting answers to. Again, all the most current information will be posted on Eastern Idaho Public Health's website. That is www.eiph.idaho.gov. The COVID-19 hotline that we've set up, that number is 208-522-0310, or people can also call toll-free at 855-533-3160. So at this point, I would like to, I also just want to mention one thing, that we know that this is just not going to be resolved in a matter of weeks. As Mayor Merrill mentioned, it's going to take some time as we get through this situation, and so continue to do those things that he mentioned. But we need to be planning. We need to be taking those precautionary measures and helping take care of each other. So we'll open it up for questions.
So the individual sought treatment almost a week ago. Why was it not confirmed until this afternoon?